If you're watching this video, you're struggling with something to do with your gut. And IBS and IBD and GERD, what are these words? Let me make it a little bit clear to you. Now, a lot of times when people get diagnosed with IBS, people around them might say these symptoms are only in your head. You really don't have any real symptoms. That's not true. If you're struggling with IBS or IBD, you probably are going through a lot of symptoms, and some of the clients who I've met, we also see agoraphobia, the fear of leaving home because you're so tied to your bathroom schedule and you don't know what to expect from your own body. Let's decipher this and let's also understand how to manage this condition. But first, let's start with the difference between IBS and IBD. IBS is irritable bowel syndrome. IBD is inflammatory bowel disease. Now, to be diagnosed with IBD, you should have got a colonoscopy done, and you should be able to see, or your doctor should be able to tell you that you do have active ulcerations or inflammation. What does that mean? What does ulceration mean? What does inflammation mean? What does colonoscopy mean? Colonoscopy is basically a test where they put a camera inside your rectum to just see the status of your intestine. Ulceration is, imagine you fall down and you bruise yourself. So you bruise your knees, you hurt yourselves. There's going to be redness, there's going to be pus formation, there's going to be blood, and that is the way of body recovering itself, right? The pus is actually there to help you heal your body. This is what ulcerations essentially is. So your doctor should have done a colonoscopy and told you that you have active inflammation, active ulcerations. There are various other diagnostic tests also, but a colonoscopy is important to know if you have IBD. The other symptom is bloody diarrhea. If you do have bloody diarrhea, if you're going to the bathroom and you see blood in your stools and you have diarrhea, that is IBD, and that can be very, very scary for a lot of people. No matter what it is, IBD or IBS, there are ways to help you manage the condition. There are also ways to help you reverse the condition, and we will discuss some of them in today's video so you get some clarity. So don't worry about it. It's okay. We can fix anything. The third question people ask is, can IBS lead to IBD? Now, IBS, you don't have active ulceration, so your tests come back negative, but you continue to struggle with gut symptoms. You might have bloating, you might have diarrhea, you might have constipation, you might have acidity, you might have gastric, but your test does not show anything. That's when doctors say it is IBS, or irritable bowel syndrome. Irritable, you have an irritable gut. Certain foods are causing a problem, certain foods are fine, but you haven't really figured out what's really happening. But can IBS lead to IBD? But more and more patients I'm seeing now, it's becoming evident that IBS is because of lifestyle factors, nutritional factors, and many times IBS can lead to IBD. Irrespective, when you do see symptoms of gut problems, you want to treat it. You don't want to let it go to a point where it is too much. So what are the symptoms of IBS? We are going to focus only on IBS today. In today's video, we'll do IBD probably sometime later. If you're struggling with IBS, you might have loose motions, you might have constipation, or you might even be oscillating between the two. Now, there's also a condition called overflow diarrhea. Overflow diarrhea is when you have constipation for a few days, and because you're so constipated and everything is so backlogged in your gut, nothing but liquids come out. So you'll have constipation for a few days and then a burst of diarrhea, but then going back to constipation and again diarrhea. So IBS could be constipation, it could also be diarrhea. You could also have nausea, and nausea is a sign of your body rejecting food. Somehow the food you're eating is causing inflammation, it is causing constipation, and it's causing trouble to your intestine, and this might lead to nausea. Vomiting can be another symptom, and anxiety can be another symptom. Your gut health is strongly related to your brain health. So if your gut is not okay, like you remember the times when you are anxious about a news, or you're waiting for something to come and you're very, very anxious and you have to rush to the bathroom 2-3 times. You have a big meeting or presentation and you have to go to the bathroom and you have loose stools. Even for people who don't have IBS, they also might struggle with this. That's because your gut health is linked with your brain health. So anxiety might be another symptom of someone struggling with IBS. Stomach pain can be another symptom. So let's say stomach pain after your meals, or stomach pain on waking up. If you're fasting for too long and you have stomach pain, that's also linked with IBS. Something is probably wrong in your stomach. So what do you do? Now, IBS can have multiple causes, so many different causes. And the first step to do is figure out what is causing your IBS. Let me explain a few causes and maybe some of them can resonate with you. Number one could be an infection related IBS. So let's say there's an overgrowth of certain bacteria in your gut. Let's say there is, we call it SIBO, SIBO, or an H. pylori infection. One of these infections can cause all of these symptoms and you have irritable bowels, but that's because it's an infection or an overgrowth of a bacteria that you don't want in your gut. The second reason could be a mechanical problem. Things like hiatus hernia or achalasia cardia, when the esophagus, the pipe which is going down your mouth and connecting with your stomach, the valve in the pipe is loosened. So conditions like this can lead to IBS symptoms because the valve is loosened. You do see a reflux of gases going upwards. The most common cause of IBS which I've seen with clients is something called gut dysbiosis. Dysbiosis is when the ratio of the good to the bad bacteria in the gut is skewed towards the bad bacteria. You have more bad bacteria than good bacteria in the gut, and because you have a lot of bad inflammatory bacteria, they are causing an havoc. And how do you manage this? Nutrition, lifestyle, everything plays a role, but certain foods when you start including in your diet can skew the balance back and you also start repopulating the good bacteria. There are certain foods which kill off the bad bacteria, and there are certain lifestyle changes which also make an effect in terms of the ratio of the good to the bad bacteria. So in terms of what you can do, number one, get a proper diagnosis. Number two, if it is gut dysbiosis, work with an expert in terms of skewing the ratio back to normal. Number three, the combination of psychotherapy with medical intervention works much better than medical intervention alone. Like, check this particular study out. In this study, there were two groups. One group was given only medical intervention, while the other group also received psychotherapy with medical intervention, and psychological intervention working with a counselor or a psychologist made a huge difference. So if you're already struggling with IBS, sometimes I've seen this with clients many times in the past, where past trauma can lead to constipation, and constipation causes IBS. So actually we don't see an improvement in terms of constipation till you have resolved the past trauma, and you can't do this with a nutritionist or a doctor. You need an expert in that field, and that's mostly a counselor or a therapist. It would be dairy, coffee, eggs, wheat and soy. Fast food, of course, you want to keep it to a minimum or avoid it completely. And alcohol is another thing you want to completely avoid till you start feeling better. But besides this, the exact nutritional intervention will depend on what you're struggling with. You can start taking steps in terms of increasing the diversity in your diet. What is a nutritional intervention? Nutritional intervention will differ based on what is causing your symptoms. So let's say someone is struggling with gastric alone. I want to make sure I rule out all the causes for gastric, like are you inhaling a lot of air while you're eating or swallowing? We call this symptom aerophagy. Or is it is someone struggling with bloating? Then I want to make sure that there's no infection leading to bloating. So your treatment really, or nutritional intervention really, will differ based on the condition you're working with. I know for certain clients who struggle with IBD, which is inflammatory disorder, and you see a lot of inflammation, we start with something called as medical fasting. You're fasting and introducing something called an elemental diet. An elemental diet is essentially taking only powders which are broken down into its just the nutrients. You're just allowing the body to take enough nutrients to let the inflammation completely resolve. Because remember, digestion is inflammatory. Even if you're eating healthy food, even if you're eating a kale salad, the process of digestion is inflammatory. So you want to give the gut a complete rest. Don't bother it for some time, and then we start reintroducing foods. We might do something called a low FODMAP diet and elimination protocol. But if there's a few foods I will avoid which shows a difference for at least 50% of the patients, it would be dairy, coffee, eggs, wheat and soy. Fast food, of course, you want to keep it to a minimum or avoid it completely. And alcohol is another thing you want to completely avoid till you start feeling better. But besides this, the exact nutritional intervention will depend on what you're struggling with, and you can start taking steps in terms of increasing the diversity in your diet. What is one myth which I've seen, especially when it comes to IBS management? When someone's struggling with IBS, they often tell me that their doctors told them don't eat a high fiber diet because fiber is triggering to the gut. Yes, fiber triggers the gut. Fiber is hard to break down, but fiber is also the fuel to the good bacteria in your gut. So if you're looking at reversing IBS completely, you want to make sure you slowly start introducing fiber, but take your fiber number up and take it as high as 25 to 35 grams per day. Very slowly introduce it, of course, and make sure that you're working with an expert to do this. But fiber is what's healing you. So you can't say no to fiber for your entire life, and you can't keep reducing the food groups you're eating. And fiber is found predominantly in plants. So if you're saying no to whole grains and pulses and lentils, you're not getting enough fiber in your diet. Again, work with an expert, because it's such a vast subject and it's not very easy to pinpoint what is causing your IBS symptoms. Only enough time and communication with an expert can help you with that. But I've written a detailed blog on IBS with much more information. Please feel free to read that in a caption for more information. All the very, very best with your healing journey. And this is Roshni Sangvi. I'm a registered holistic nutritionist.